Hey guys, now I'm going to talk about tardive dyskinesia. Like I said, it's one of the side effects of taking an antipsychotic medication. It is a movement disorder that results in involuntary and repetitive muscle movements. It commonly affects the face, tongue, and the limbs. And it's a side effect, like I said, of these long-term use of certain medications, particularly those that are used to treat schizophrenia. What causes it is a prolonged use of the medications that affect dopamine, which is a chemical in the brain responsible for movement. These medications, known as antipsychotics or neuroleptics, they're often prescribed for schizophrenia, bipolar, and depression. And over time, they can interfere with the brain's ability to control muscle movements, leading to TD. So, who is at risk in particular for developing tardive dyskinesia? So, anyone who is on antipsychotic medications long term, and the longer they're on the medications, the greater the risk. Patients who are older in age, they're more vulnerable. A female gender, surprisingly, especially postmenopausal women, are at higher risk of developing TD. Of course, having a mental health condition, because you're going to be prescribed these medications, puts you at an increased risk. And if you have diabetes or some other medical conditions, they could contribute to the likelihood of developing TD. So symptoms can range from mild to severe, and some of these symptoms include uncontrollable facial movements such as blinking, grimacing, or sticking out the tongue, jerky movements in the arms, legs, or torso, lip smacking, chewing, or pursing of the lips, and difficulty speaking or swallowing in severe cases. Now, the doctors and providers play a crucial role in helping patients to identify early symptoms of TD. And regular checkups and medication reviews allow these healthcare providers to assess any emerging signs or abnormal movements. And they use a standardized assessment tool to monitor changes and make adjustments as needed. And they educate the patients and their families how to recognize these symptoms. And the assessment tool that is used by healthcare providers is called the Abnormal Involuntary Movement Scale, or AIMS assessment. This tool helps the doctor systematically check for signs of TD by evaluating different areas of the body for involuntary movements. The AIMS test involves observing facial expressions, jaw movements, limb motions, and overall motor function. Regular AIMS assessments help in the early detection of TD and allowing the timely treatment adjustments that need to be made to prevent worsening of the condition. So, while there is no cure for TD, there are several options to manage the symptoms. So once you have it, you have it. There's no getting rid of it, but we can manage symptoms. So medication adjustments, lowering the dose of the antipsychotic medication or switching to a newer drug with a lower risk. There are certain FDA-approved medications for TD. Valbenazine and deutetrabenazine can help reduce the symptoms. And there's some off-label medications that can be used. And these include a benzodiazepine called clonazepam, can help control the involuntary movements. Amantadine, which is an antiviral and a Parkinson's medication, has been used to help reduce symptoms. Propranolol, which is a beta blocker, may provide some help for the movement disorder. And then vitamin E supplements can help with some benefits, but the research on that is limited. There are some supportive therapies as well, physical therapy and speech therapy to help control muscle movement, reduce discomfort, and those who have the facial tics to help with their speaking ability. And of course, lifestyle changes can also sometimes be effective. Healthy diet, exercise, and stress management can help reduce the symptoms. So if someone has TD, how are they living with it? They need proper management of the symptoms to maintain a good quality of life, recognizing the symptoms early in order to get the treatment right away, discussing these concerns with their healthcare provider, working closely with their providers. They can, individuals can reach the best possible management. So Even though it is a long-term condition, it is not curable, it is manageable. But understanding the risks involved with antipsychotic medications, knowing your body, having regular conversations with your provider, following up with your healthcare provider, and seeking appropriate treatment can improve the outcomes. And if you know anybody who may be taking these medications and starts having weird movements, encourage them to seek out help with their healthcare provider as soon as possible. And I will see you next time.